Today I'll be just talking about like how to write a proper death certificate. Dr. Gaurav has already given you a glimpse of like what a proper certificate should look like. So I'll just dwell a little more in detail regarding the proper death certification. Now, just before I go into the proper death certification, I would just like to give you something about the history. Now, it's way back, if you go into the historical aspect of properly writing a death certificate, even at the time of like the first autopsy, which was nothing but the examination of the body of Julius Caesar, and it was done in 44 BC. And the finding of that autopsy was that he had 23 wounds, but only one was fatal. So what this suggests is that you have to be very precise. So death certificate has to be very precise that what has been the cause of the death of the particular patient. Now, if you go to the history, you'll see that registration of birth and death, it first started in England in 1538. And the classification of the causes of death based on the Farr's principle. Now, William Farr is known as the father of writing the birth and death registration. That was adopted in 1893, and then it was evolved and adopted into the International Classification of Disease by 1948. As far as India is concerned, the registration of births and deaths started in 1969. There was an act for birth and death registration. So before I go into the proper presentation of how to write a certificate, I'll just talk something about the terminology. We'll discuss a few cases and then few practical tips, which we should not forget whenever we are writing a death certificate. Like this is just a case summary, like 70-year-old male, known case of diabetes, hypertension, COPD, admitted to emergency with fever, shortness of breath, cough with expectoration and hypotension. The patient worsens in the emergency, is shifted to critical care medicine, reaches the ICU, he is intubated, vasopressors are started for circulatory shock, he suffers AKI, renal replacement therapy is started, and after 4 days of ICU stay, he suffers a cardiac arrest due to multi-organ failure. Now, can anybody, based on this summary, tell me the components of the death certificate? If anybody is willing, what would be the underlying cause, what would be the antecedent cause, and what is the final cause of death? Dr. Gaurav had told you there are 3 important lines, A, B, and C. So can anybody want to comment? Would like to
immediate cause, multi-organ failure, Afzal?
A. So when we write a death certificate, I will tell you in the future slides that we should always try to begin from C. Then we go to B, and then we go to A. So what should we see in this death certificate?
Hypertension, diabetes, and COPD.
And COPD. Okay, so based on the just a case summary, what do you think led him to admission to emergency? Was it diabetes, or was it hypertension, or was it COPD?
COPD.
It looks COPD. Yes. So diabetes and hypertension are not important for this death certificate. They can come in the significant conditions contributing to the death, the second part of the death certificate. So what I want to emphasize here is that you have to be precise. If you write diabetes, hypertension, and COPD on the line C as the underlying cause, then when this death certificate is analyzed, like what led to the death of that particular patient, then the statistician who is putting that particular disease into the coding and then giving the final cause of death, he may confuse whether it was diabetes, because he's not a doctor, whether it was diabetes, whether it was hypertension, or whether it was COPD. So per se, looking at the case summary, it looks that the most appropriate underlying cause is acute exacerbation of COPD. And then he landed up with severe pneumonia. Severe pneumonia means he had shock, multi-organ failure, and ultimately A is multi-organ failure. Now, just writing multi-organ failure is also not enough. The recommendation is that when you are writing the line A, you have to be specific. Multi-organ failure means 2 or more organs. So you have to write which organ contributed the maximum towards the death of that patient. So suppose it was severe septic shock. So then multi-organ failure, and then in the brackets, you have to write cardiovascular system. So when we analyze that death certificate, we understand that COPD patients, how many COPD patients, they land up with severe pneumonias, how many patients of severe pneumonias, they land up and they die because of septic shock or cardiovascular system failure. And this is how we analyze, if you look into the epidemiology, the world statistics, that what is the leading cause of death in COPD patients. We come to analyze those data only when a death certificate is properly written like that. Now, we all know that death certificate is a very vital document. It is a legal document, yes. It has got a lot of importance as far as the epidemiological data is concerned, and it contributes to research. Because based on the death certificates, we can analyze that which is the highest contributor to mortality in this particular settings, in this particular state, in this particular country, in this particular part of the globe. So it is a very vital document, not only just from the legal point of view, but it contributes immensely to epidemiological data and research. Now, this is just to give you an example. This is an old data like of 2009. How does WHO say that these are the leading causes of death? It only comes to the death certificate. So if the death certificates are not properly written, we are not sure whether our statistics is correct or not. And we are contributing wrong data to the statistics if they are not written properly. It is important for the family. Yes, we know there are a number of reasons. It is important at the national level, just as I told you, for planning, implementation, resource allocation, evaluating the health interventions. We look at the maternal mortality rate, that what are the leading factors which are contributing to maternal mortality, infant mortality, geriatric mortality, what are the complications, how many people are dying because of complications of diabetes, hypertension, and then we can allocate the resources in those areas and we can plan some interventions in those areas. So it is a very important document as far as the census studies is concerned, population studies are concerned, and for research purposes. Now, death certification, writing a death certification is a process. It is a process. So the person who first pronounces the death to the family is known as a certifying physician. And the second important thing is immediately you know whether it is a natural or unnatural. Then there are some notifications which you need to do immediately when the patient dies, whether it needs to be notified to the police, to the coroner or not. So these are one of the three important things. Immediately the process should start the moment the patient dies. Now, if you look into the death certificate, as I told you, there are two parts, part 1 and part 2. So part 1 has got three major components. Now, who is the certifying physician? So the one who certifies the cause of death is known as a certifying physician. Now, what is underlying cause of death? Now, these definitions and terminologies are extremely important. The disease that triggered the chain of events leading to the patient's death and without which death would not have occurred. So without which the death would not have occurred. This is the underlying cause of death. The third line in part 1. It must appear on the lowest completed line of part 1 and it should be as etiologically specific as possible. And this is just to give you an example. Like atherosclerotic coronary artery disease. So you have to be very specific for the underlying cause of death. Then comes the antecedents, intervening, or even the intermediate causes of death. A disease or condition that occurred as a result of the underlying cause of death. So that means there has to be some relationship between underlying cause of death and the antecedent cause of death. But still, it was not the final complication or the immediate cause of death. So antecedent means it has to have a direct relation with the underlying cause of death, but still it should not be the final complication or the immediate cause of death. So like in this death certificate, atherosclerotic coronary artery disease was the underlying, followed by a thrombus, and the thrombus led to acute myocardial infarct. So antecedents, you can have 2 or 3. You can even write in between if you feel like that there were more than 2 or 3 antecedent causes which ultimately led to the immediate cause of death. So this is the antecedent, and it should have a direct relation with the underlying cause of death. So in this certificate, the patient was admitted with an underlying atherosclerotic coronary artery disease, developed a thrombus as a result of that. Thrombus led to acute myocardial infarct. So this is the relationship between underlying and antecedent causes. And then we come to the immediate cause of death, the final complication resulting from the underlying cause of death and occurring closest to the time of death. So if you are in the habit of filling that the column for the time, then again you will have some idea that whether I'm filling the death certificate in a proper manner or not. So atherosclerotic, now if you look at this death certificate, coronary artery disease, he was having it for years. If you look at the time column, then he developed a thrombus, 6 days. Then he developed an acute myocardial infarct, 6 days. And this acute myocardial infarct, he died because of complication of this myocardial infarct, which is nothing but the rupture of the septal myocardium. So ultimately he died because of the rupture of the septal myocardium. Now, when this certificate is analyzed, like what is the contributory cause of death for atherosclerotic coronary artery disease, you can find a relationship between patients with atherosclerotic coronary artery disease dying with rupture of the septal myocardium. How many patients are dying because of the rupture? So this is the importance of the death certificate. Then there are some mechanisms of death. Like we are in the habit of writing cardiac arrest in the topmost line. Ultimately, there is a cardiac arrest, cardiorespiratory arrest. But these are the mechanisms of death. They are not the underlying immediate cause of death. So what is mechanism of death? A physiological derangement or a biochemical disturbance by which a cause of death exerts its lethal effect, but it should never be used as an underlying cause of death or immediate cause of death. So we should not be in the habit of writing a cardiac arrest or respiratory arrest. Then non-specific conditions, like an anatomic or a functional derangement that has got one or more possible causes. So sepsis. Now, what kind of sepsis? Now, if you go into the properly writing a death certificate, people also suggest that if you write sepsis, you should be more closer to sepsis, gram-positive sepsis, gram-negative sepsis. And even if you have got some reports, the culture reports are available with you, that you can even write, suppose the patient died because of bacteremia or Klebsiella bacteremia or Acinetobacteremia or Candidemia, then you can write Candidemia. So we will know that how many patients are dying because of Candidemia, bloodstream infections, how many are dying because of Klebsiella bloodstream infections. So you have to be as far as possible, you need to be as appropriate as possible when you're writing the conditions. Hemorrhage. Now hemorrhage can be any hemorrhage. So please try to be more specific whenever we are writing these conditions. Heart failure, systolic heart failure, diastolic heart failure, what type of heart failure, congestive cardiac failure. So we have to be precise. Renal failure. Now renal failure, these are very broad definitions, renal failure, heart failure. So we have to be precise. It was an acute kidney injury leading to renal failure. But these non-specific conditions should never be used as underlying cause of death. So what you have to understand is that there is an underlying cause which has to be very specific. Then there are few antecedent causes of death, and then ultimately is the immediate cause of death. Mechanisms of death and non-specific conditions, they are to be avoided as far as possible. Then manner of death. So this is very clearly written in all the certificates, and we know whether it is a homicidal, suicidal, accidental, or if it is undetermined. Now this is just the summary of the terminologies which we have discussed so far. So we should know, like, there are two parts, part 1 and part 2, and 3 lines. Part 1, start from C, go to B, go to A, and part 2, the conditions which you think were significantly contributing to the mortality. If they were not, you can even omit it. Now, what are the errors? Now, this is a global issue. And what important thing which we have learned over the years is that experience does not appear to improve the death certificate. The junior most doctor may be the most expert in writing a proper death certificate. If you ask a faculty to write a death certificate, maybe it may be full of errors. The reason is he has forgotten. And those departments and those specialties where the death rates are less, there the complications, where the complications of sick patients are less, and because of less complications, less comorbid conditions, there if the death occurs, then the chances are that it may be full of errors. Now, why, like, if you ask me, like in my department, we have got a mortality rate of almost 40 to 50%. So if we have got 12 patients, we know that 5 to 6 patients are going to die. So if we have around 300 admissions in a year, almost 140 to 150 certificates are written in our department. So we need to be very precise, otherwise we are contributing a lot to the wrong death certificates, not only to the state, but also to the nation and ultimately to the global contribution. And it's a global issue. So some of the factors which have been associated, that why do the errors occur in death certification, like our training. Now, if you go back to the training in the MBBS, we talked about the writing a proper death certificate during our forensic classes. And I think so it was like, it was in second professional. And we were not even like acquainted, like what is the importance of it. So we were taught writing about death certificate when it was not needed. It was needed to understand, but it was not of any importance to us. So it was just to pass the exams and pass the theory exams, that what is how to write a death certificate. The real scenario of training should come when we are become interns, when we are doing post-graduation, and when we are doing super specialties. And that is why it has been included in the foundation course at SGPGM. Writing the proper death certificate, it's a very important document. It's a legal document for you. It is for the institute, and it is for the nation as well. Inexperienced house staff, fatigue, time constraints, unfamiliarity with disease. Now, what we're happening is now we are encountering patients who have got multiple interventions, multiple comorbidities. So sometimes it becomes very confusing, even for the bedside resident doctor, even for the bedside consultant, that what should be the proper death certificate. So what is recommended is that when you are encountering a very critically ill patient, when you are encountering a patient who has got multiple diseases, multiple disorders, and you're not sure, then and if you perceive that this is the patient who is likely to die in the next 12 hours, 24 hours, he's quite sick, he's on he's on ventilator, he's in multi-organ failure, severe septic shock. So that death certificate needs to be discussed at the bedside. Like you have a clinical discussion for the patient, similarly, the death certification needs to be discussed at the bedside. That, sir, how am I going to write this death certificate if this patient dies in my unit? And similarly, the faculty also has the responsibility that if he can perceive that this is a sick patient and is like a very complicated case, and my resident may have difficulty in writing a proper death certificate, then it becomes the duty of the faculty also to write that what is going to be the underlying cause, what is going to be the antecedent cause and the immediate cause of death in this particular patient. Complex case scenarios I've already discussed. And junior most resident, like what happens is, during our training, we hardly give any importance to the death certificate. This is what we learned in the internship. The junior most, just write the death certificate for that patient who has died. Sir, what to write? Just write cardiac arrest. And this is how we used to fill the death certificates. Nothing, no importance. And if you understand and analyze how, with experience and with over the years, we have realized that those death certificates had no meaning, nothing. Just writing one single word, cardiac arrest, has got no meaning. It has not contributed to anything. So training is important. Training is important, and we should have regular discussions amongst the residents and amongst the faculties, especially for difficult case scenarios. Now, what can be the errors in death certificate? There is also classification for errors in death certification, and they have been classified as major errors and minor errors. Now, major errors are important, because if you write major errors are there in the death certificate, then it has got very less meaning. Mechanism of death listed without an underlying cause. So if you do not have an underlying cause and straight away you write cardiac arrest, it's a major error. Improper sequencing. Sequencing improper means there has to be some relationship between the underlying, the antecedent, and the immediate. If there is no relation, we're starting with COPD, and in the antecedents we are writing CAD, and we are writing pneumothorax or something like emphysema, and then we are writing cardiac arrest. That certificate has got no meaning. There has to be some relationship, some sequencing. competing causes. Now we don't know the patient was admitted with COPD and diabetes, and we don't know which is contributing to the death. So, and we are writing both COPD and diabetes, then we don't know which is then progressing and which ultimately led to the death of the patient. So if you feel like that it was only COPD, write COPD. So two competing causes should not be written in the underlying cause of death. Then there are some minor errors like do not write abbreviations, do not miss the time column. Mechanism of death, if it is followed by a legitimate underlying cause of death, it becomes a minor error. Means if your underlying cause of death is correct, your antecedents are also correct, and if the immediate you write cardiac arrest or cardiopulmonary arrest, then that certificate still has got some meaning. It is a minor error because the most important line in the death certificate is the underlying cause of death. Now, if you look at some of these death certificates, and these death certificates are what I'm presenting is some of the certificates from my old department. Mechanism of death listed without an underlying cause of death. So nothing is there. Just cardiac arrest, minutes, nothing is written over there. So this becomes major error. Improper sequencing. Patient, if you look at the lowest third line, chronic obstructive pulmonary disease, years, leading to pneumonia and leading to emphysema. And patient may have died because of pneumothorax or something. But here it is written emphysema. No meaning. It has got no meaning. Nobody can analyze this. Nobody can analyze this death certificate. So it's a major error. Improper sequencing. Pneumonia contributing to emphysema. Two or more causally unrelated etiologically specific diseases. You look here, chronic obstructive pulmonary disease and CAD. And then if you look at the antecedents, acute exacerbation of COPD. So CAD has got no meaning. Now, when this certificate is being analyzed by a non-medical person, by a statistician, he gets confused whether COPD or CAD. And he may write CAD. So he may fill the coding for CAD. And what is the antecedent? Acute exacerbation of COPD. Improper sequencing. And ultimately he died of respiratory failure. So two or more causally unrelated causes should never be written in the underlying. So you have to decide which has been the leading contributor to death. Then minor errors. DM. We believe that everybody knows what is the full form of DM. We believe that HTN means hypertension. We believe that renal transplant is RTX. We believe that the patient who was on multi-organ failure, MOF. We believe that coronary artery disease is CAD, and everybody knows. Who analyzes the death certificate knows that it is CAD means coronary artery disease. So abbreviations should never be mentioned in the death certificate, though they are taken as minor errors. Time interval. As I told you right in the very beginning, that if you're in the habit of writing the time, you will know whether I'm filling the certificate properly or not. So time column, if it is missed, it becomes a minor error. But if it is written properly, then your death certificate gets some importance, and you will also realize that my antecedents and immediate causes are not incorrect. Then the mechanism of death, followed by a legitimate underlying cause of death. So I told you, we should avoid writing cardiac arrest, we should avoid writing respiratory arrest or cardiopulmonary arrest. But if it is written on the top, but if the underlying cause is correct, the antecedent is related to the underlying cause, then it becomes a minor error. So coronary artery disease, acute myocardial infarction, ultimately died of this. So this is still acceptable, provided you have a correct underlying cause and a proper sequencing of antecedents. But cardiac arrest should be avoided. Now, these are some of some true certificates from our institute. COPD, CAP, AKI, bilateral. We are always in a hurry when we are writing a death certificate, as if it is not an important document. Full of errors. Look at this. These are two certificates. AKI, ALI, septic shock, and refractory metabolic acidosis. May have died because of metabolic acidosis. Agree. pH 6.9. But then that is a physiological derangement. And physiological derangements are mechanisms of death. So they can never come as immediate cause of death. age has been just forgotten. Now this is, time is missing. A lot of abbreviations are being used. CVS, ABD is abdomen, renal. Not that this resident tried to be very specific for multi-organ failure. So he wrote CVS, abd, and renal. Now, does everybody know that ABD means abdomen, maybe intra-abdominal sepsis? That would have been much appropriate for him. So you have to be very cautious when you are writing a death certificate. It's a very important document. So devote some time. And if you are confused what to write, please discuss with your seniors and with your family. Now there is what is missing here? No underlying cause. So when there is no underlying cause, this death certificate has got no meaning, because we don't know why the patient was admitted and with what disease the patient has died. He ultimately died of multi-organ failure, but what led to multi-organ failure, we don't know. So it is not contributing anything to the statistics. No patient name, no doctor's name. All in a hurry because this has got no meaning. Verification is missing. And these are 2 certificates. So some important tips: never use abbreviations. ACS, acute coronary syndrome, and it can become abdominal compartment syndrome. Do not use number for men. Always spell out the month. It's always better to write 13th of January rather than 2013, then -1, and then 2010. Because it can easily become 1311. See, you can use that, the whole document gets changed. And it's a very important medical legal document. So this is the proper way. Always spell out the month. Or if you have to use a single number for the month, if you want to use it 1, suppose January 1, you write it 01. Do not alter the document or erase any part of it. So if you feel, no, this is wrongly written, I missed it, I have wrongly spelled it, I have written some short forms, I have written some abbreviations, I've forgotten the time column, it is always better to write a new certificate. It is always better to write a new certificate. Do not overwrite, do not erase. Always write legibly. Can anybody read it what is written? If you cannot read your own handwriting, how can a third person read your writing? And it is always preferred to write the entire death certificate in bold letters, capital letters. Complete all the required items. So there is a checklist. You have to start from the top and you have to finish at the bottom. And you have to see that each and every line and every column is filled. If you feel like that it is not important for this particular death certificate, draw a line over it, cut it, cross it, or you can write not required, but do not leave anything blank. You can do like this. Now, do not delay. Time is important. It's important for the family. And even if you must have encountered in our situations, the family has to take the body to distant places. So time is important. Even if you're doing anything important for some other patient, please leave it. First thing is, whenever there's a death, you have to give some respect to that patient, respect to the family. And your first priority becomes always, whenever there is a death in the ward or death in the ICU or death in the emergency, the first thing is that you have to give time to the death certificate, and that becomes your priority. Now, some tips which are very important is, and which have come over the recent years, is that you are used to allow terms like probable, likely, and presumed. Now, the patient came to you, suppose with the chronic liver disease, and you were working with it, you were not sure what is the etiology behind it. You have done a biopsy, the biopsy is awaited, and during that course of treatment, the patient dies due to some like shock or multi-organ failure, and you write the certificate, but you're still not sure. Your cultures are awaited. So this much leverage has been given to the clinicians now. You can write probable, you can write likely, you can write presumed. But still you write, you have to be as specific as possible. Like urosepsis, patient was admitted with urosepsis. So if you have got some preliminary report that it's some gram-negative organisms are growing in the urine, you can write urosepsis, brackets, most likely gram-negative infection. Now you see and you realize the importance of this. When we analyze the death certificates over a period of time, when we do some statistical analysis, when it goes from statistical data, we will understand that how many gram-negative urosepsis patients are dying of multi-organ failure. And in between, suppose the patient suffered from septic shock, and if it is gram-negative or if it is fungal sepsis, you can write gram-negative sepsis, fungal sepsis. So we know how many patients are dying because of fungal sepsis. So most probable, most likely, it is all allowed to you. So you are the key, both for national and international data. And it depends, a lot of information depends on a properly written death certificate. You're not just signing a death certificate, you're investing in future, because there may be some resource utilization, resource allocation, epidemiological studies, simply based on the death certificates. What is the leading cause of mortality in a particular area? And that will definitely lead to improved medicine. So death certification requires skill. Skill is important, but at the same time, there has to be a continuous educational intervention. If you are in a specialty, you're not writing regular death certificates like we are writing in critical care, then over a period of time, you may forget. So we need a continuous educational process so that everybody is updated that how to write a proper death certificate. Thank you very much.